Drinking has long been woven into military tradition and culture, from promotion ceremonies to celebrating returning home from a deployment to hail and farewells, prop blast. Any number of events have a component of drinking associated with it. But for some of us, alcohol becomes a little more than a tradition. It becomes a way to self-medicate, to numb our pain, to help sleep with things, to suppress intrusive memories, and some just to get through the day. In this episode, I'd like to talk about alcohol misuse, how common it is amongst veterans, and what its effects are to the body, and how it can be treated. The VA has kind of identified that over 40% of veterans will meet kind of DSM criteria for alcohol use disorder, with that percentage being even higher among soldiers who have just returned from a deployment. And interestingly, when they went back in these studies and kind of scoured the health records, there were not an insignificant proportion of veterans who met criteria for alcohol use disorder, but either never had a documented conversation, never had it listed on their problem list, and it went unaddressed, which is not a great place to be with something that can have such profound impact on your life. Veterans, especially returning, at the height of the GWAT, returning from OIF and OEF, had a concurrent diagnosis of alcohol use disorder with PTSD of about 63%. And I think that makes kind of anecdotally makes a lot of sense with helping to sleep, just coming back home and wanting to celebrate a little bit, trying to maybe suppress some bad memories of things that happened, and the effects of PTSD, the kind of hyper-arousal, the hypervigilance that we've talked about before, the anxiety, the nightmares, kind of all these things. And alcohol works, like I said in the previous video, on kind of GABA suppression, which is works on the neurotransmitter GABA, which is kind of a suppressive, kind of slows the brain down kind of thing. So all these kind of very, for lack of a better word, the hypervigilance, the arousal, these kind of aggressive symptoms, it kind of tamps down. And it does that for a time, but ultimately the effects of the alcohol are counterintuitive and work to exacerbate those symptoms, especially in things like sleep. As we've said before, like issues around sleeping, drinking and sleep, retards your ability to get into REM sleep. And it's not a great tool to help with those symptoms. Alcohol affects the body in a number of other ways physiologically. Long-term use, when I get to take care of our older veterans, or even some of our Vietnam era guys, they have some much longer-term effects with their memory, dementia, that lead to some really significant impairments older in life. And it's also a very pro-inflammatory state. So, we talked here in the last couple episodes about obesity in the veteran populations and diabetes and things like this. So now we've added yet another inflammatory state to the body that is just kind of making our body's baseline even more aggressive and inflamed. The alcohol affects your blood vessels. It tightens them up. It dysregulates some of the chemistry that helps to regulate some of that. On top of the obesity and the fat getting kind of brought into the liver, it works on the liver in other ways too, and worsening the fibrosis, and turning to cirrhosis. And in veterans and folks who have alcohol use disorder, there's about I think it's almost a 45 or so percent higher risk of cardiovascular disease compared to those who don't drink. And about 15% of people who use alcohol pretty heavily will develop cirrhosis, which is, the liver's just not processing poisons and toxins the way it's supposed to, and so it builds up in your body. And having taken care of a number of veterans who either are on the transplant list or have just come off of a transplant, man, that is a tough thing to have to go through. It's not something I wish on anybody, as a really tough disease process to kind of experience in your life. And then on top of the kind of the physiological manifestations of the alcohol, you've also got the mental health effects. With veterans who are drinking and have PTSD, with depression and anxiety, worsening, suicidality in the time, especially under the effects of alcohol. And the VA has kind of talked about the concomitants, or that's kind of two things working together, of PTSD and alcohol use and suicidality as almost being, a 3x multiplier of the risks that go into that, which is very dangerous, especially in the veteran population, which has, we haven't got into it, but has a much higher risk of suicidality compared to the general kind of population in the United States. There are some ways to kind of to screen for this. If anybody's interested, you can look into DSM-5 and look up alcohol use disorder and kind of see what the diagnostic criteria are. But some of the kind of screening questions to ask yourself, or maybe somebody who's struggling with this, is how often are you drinking? How much are you drinking when you are drinking? And how often do you binge drink? I think binge drinking is, I think it's more than, was it 4 or 5 drinks in a sitting? Also, if you're having if drinking is causing you to have any type of relationship problems, legal problems, work problems, those will all be kind of good indicators that maybe you have an unhealthy relationship with alcohol. And there's certainly, I think one of the challenges with it is there's also a stigma around it because of how common it is on active duty, that to recognize it as a problem can be tough, because it, at least certainly when I was on active duty, was such a common theme, just day to day, that I think it may be internalized as normal, which I think is a very dangerous place to be when we're just talking about our health and wellness. There are a number of treatments that work for this, that can help reduce cravings. I'll talk about here in a second, but using medical management by itself has some effect, but the best combination is medical management with either an intensive outpatient program like IOP or residential treatment. And some of this is going to take a lot of time to get through. Addiction is a really tough barrier to kind of break down. The good news is there are a couple medicines that help with this. One is gabapentin. It kind of it works on the same GABA receptors. It can help reduce cravings. Others are medicines like naltrexone, which also reduce cravings and can kind of disconnect the reward of drinking, so you don't quite feel like it's as satisfying. And then the others are things like topiramate, which also has the added benefit of working on mood and improving PTSD symptoms as well. So there's a couple different options there. There are some older school medications like acamprosate, which is not in favor anymore. I feel like it's kind of fallen out of favor a little bit. And using this with therapy has kind of the best proven outcomes for folks. There is certainly a treatment gap. Like I said, the number of people who, when the VA looked back and said who met criteria for alcohol use disorder and who was actually getting treatment, there's a gap there. And part of that is, one, I think for clinicians, it can be difficult to start to address this issue with our patients. because some people take it can be a very sensitive topic. But I think it's one that we need to have, and especially because stopping alcohol, if you've been using alcohol for any length of time on your own, and kind of stopping it spontaneously can be very dangerous. So any folks who are in that boat, I would recommend seeking some real professional healthcare advice on how to come off of using alcohol regularly, and then looking at tools to help reduce your cravings, reduce the urge to drink and how much you're drinking. And again, I don't want to discourage anyone. This is not an easy thing. Some folks tell me they kicked it right away. I see other people at work patients at work who struggle with this pretty intensely. And it takes a lot of time for them to kind of get through that addiction. But kind of in closing here, I want to say that you're not alone here. This is a very common health issue to worry about. It's not an issue of you being a bad person or a weak person or any number of things like this. And certainly if it's helping to, or subjectively is helping to treat your PTSD symptoms, that the idea of stopping something that's been helpful to you and treating maybe your sleep or something like this is also pretty scary and can produce its own anxiety. The last piece that I think I note that I don't think it's talked about a whole lot is that when that alcohol has been used for a while and people are treating themselves or kind of self-medicating with it, is that when that's gone, even if they're having these medications to help reduce the cravings and things like this, that those issues and anxiety and stress and memories and experiences they had are still there. And those also have to be confronted. And this is a lot to get through. So I want to just encourage you guys to continue to work on your recovery and to seek help. Anyway, I hope this was helpful. Be well.